Coming to left bundle branch block. So in left bundle branch block, what happens is that in left bundle branch block, so from SA node, the activation of the action potential occurs from the SA node in the right atrium to AV node, and from AV node goes into the his bundle, and then generally the septum get depolarized from the left to right side normally. Now in left bundle branch block, what happens is that the left branch is blocked, but the right bundle branch is normal. So there will be initial activation of the right ventricle. So right ventricular activation is there, then there is followed by a left ventricular activation. So what will you see is because left ventricle is activating little later, QRS duration will be more than 120 millisecond. You will see a dominant S wave in the V1. That is reverse changes will be seen when compared to RBBB. You can see in left-sided leads, that is in the V5, V6, you can see this LBBB. The second wave is because of the left ventricular activation. The starting one is because of the right ventricular activation. Reverse changes in this one. And also there will be associated appropriate discordance will be there. The left axis deviation will be there. The proper discordance means that abnormal depolarization should be followed by abnormal repolarization as well, which appears discordant to the preceding QRS complex. So based on the QRS complex, it will be reverse changes will be there. So if you have this one there and reverse, you can see the positive QRS here. Then you can see is STT inversions will be there in the proper discordance is not. So other changes which you can see is absence of QS in the lateral leads, and there will be prolonged R wave peak time of more than 60 milliseconds. So R wave peak time is the starting of the R wave to the peak of R time, that will be slightly delayed because this is basically occurring because this is a bundle branch block and there is delayed activation of the right and left. The right ventricle gets depolarized earlier and the left ventricle gets depolarized little later. You will see this changes in this. So also, if there is a negative QRS, you may suspect this as an ST elevation here, because you can see here ST segment is the isoelectric line is here, as you can see elevation is there. So this elevation is commonly present in LBBB, but this elevation is significant only if this elevation is more than 25% of this total height. There is separate criteria for that. It's called Garbosa criteria, which I'll be telling you in my next video. You can see my channel for the Garbosa criteria as well. When to consider this ST elevation as significant, we should know. Otherwise, it is a normal variant in case of LB.